Hello everyone, Allison Steinberg here with Lindell TV. We are outside of the Heritage Foundation for the 1-year celebration of MAHA. Great event today, and we are here with Scot Faulkner of PBM Foundation. Scott, thanks for being with us today. First off, tell us a little bit about this 1-year anniversary of MAHA. How do you feel we've done so far as the health space is concerned?
It's amazing, absolutely amazing that to think of 1 year ago where we were in terms of even awareness of all the different ways people can be healthy. And now not only the awareness but real results, especially on the nutrition side, certainly on the affordable care relating to drugs and other prescriptions, and the whole concept of just making people feel healthier. I mean, it's just having government policy aligned the way it should be aligned. It's a long time in coming.
It's shocking to think that just a few weeks ago the food pyramid was flipped the other way. They finally corrected it, so that's a good step in the right direction. Now I know you're doing a lot of work in the red light space. Talk to us about red light therapy and just give us a little general overview of what that's all about.
Okay, sure. Red light is actually now one of the forefront therapies being endorsed by MAHA, and we basically think of it this way: we're all warm-blooded plants. We love the sunlight, we change color in the sun, we need our vitamin D, and so when you start to take red light, which is basically red and near-infrared light, put it intensely on the body, we start to repair cellular function at the molecular level. And by doing that, most of what ails us, injures us, or ages us improves.
That's incredible. And I know as a woman, I see a lot of advertisements for red light therapy that can help with aging or wrinkles, but I know it serves for a lot of other functions as far as health, wellness is concerned. So talk to us about some of the illnesses that red light therapy can actually treat.
Probably the most important one so far has been dealing with the side effects of cancer therapy. When people get heavy-duty chemotherapy, they get sores in the mouth, and what happens is they get oral mucositis, which means they can't even swallow, and so we can prevent that. And it's endorsed now by every major oncology group, and even places like St. Jude are actually using it for young people. In fact, what they do there is they've shaped the probe as a popsicle, so that young people are sucking on this thing and the light goes into their throat, prevents the side effects. So it's that safe. The other area probably interesting to your viewers is veterans. That veterans have tremendous problems with traumatic brain injury. The only way to really address it is with drugs. That usually puts them into an opioid cycle which ends up with lots of suicides. We're able to actually formally and effectively treat traumatic brain injury and bring their brains back to the point where it's now recommended as the therapy within the Veterans Administration.
That's incredible. Gosh, that is just groundbreaking and something that I wish more people knew about, but it seems like a lot of this information is suppressed. Why do you think that is? And what's the average response from, a typical general practice doctor on the red light?
Well, it sounds too good to be true, because here's something that is a natural process being intensified with 110 million patients being treated in clinical settings with not one single side effect being documented anywhere. But because it treats one thing really well, cellular function, and cellular function has something to do with 80% of, again, what ails us or injures us, it sounds like snake oil. And so there's a lot of skeptics out there who still, and again, part of it is most of traditional medicine is trailing edge. They really don't like to embrace new things. And this is not just a new thing, it's an old thing. It's been around the pharaohs had light chambers, and this was actually discovered in 1967 in Budapest. And so it's been around a long time, and yet too many people are still skeptical because it sounds too easy, but light is easy.
Yeah. Well, do you think in addition to the skeptics, there's also the fact that a lot of these doctors are possibly in it for the financial aspect, and a patient cured is a customer lost to many of these doctors. So
that's the big problem. And of course we know that a lot of doctors get commissions for the pharmaceuticals that they prescribe, and so it's really a grotesque mercenary culture that we're up against.
Yeah, we really are, and it just seems like it's a never-ending battle, but we are seemingly making some good progress here with this administration. What has RFK Jr., the Trump administration as a whole, what has their response been to the red light therapy?
Well, actually, the first thing is most of them use red light.
Oh, wow.
And so that makes my job and our foundation a lot easier. I mean, a few years ago, we'd talk about red light, and they say, "What's that?" Now we go up, say red light, say, "Oh, I'm using it, my wife's using it, my kid's using it, whatever," because it's used a lot in athletics. And so we can begin immediately talking about how do we make it available and make it officially covered in insurance like Medicare and other things. So we have an openness, and now we're hoping to get some of the stuff actually happening.
It's got to happen. I'm sure it's not an easy task, though, going up against the insurance companies.
Yeah, Big Pharma spends about $500 million a year on PACs and other things, and they have 1,000 full-time lobbyists. So and we're a small group.
So tell me, as far as the red light therapy is concerned, how long, I'm sure it's different for different conditions and whatnot, but how long does it generally take to start seeing results if someone were to use this?
Well, first of all, the application is anywhere from a couple minutes to 15 minutes, so not very long. It depends on the condition. If you've got an acute condition, like let's say you just rolled your ankle, it can be instantaneous. If you have whiplash, instantaneous in terms of pain removal and range of motion. If it's a degenerative condition like Parkinson's, it may take months to find effect, but then it's going to be a long-term, actually permanent part of your life. But again, we're not changing drug addiction to light addiction. At some point, there's a maintenance level if you have Parkinson's, maybe once a month being treated instead of intensely. But the beauty is any acute condition, whether it's a wound, whether it's an injury, it literally can be minutes and you're done.
How long to get rid of these crow's feet? I'm just kidding. But I mean, I know there's different forms of red light. I've seen helmets. I've seen just little plaques sort of things. There's full body. Talk to us about the different forms.
Okay, well, the thing is that depending on the condition you're treating, there are different mechanisms. So the handhelds are the most popular because that's something you can put anywhere on your body, for a sprained ankle or a wound. Anything neurological, you usually use a helmet of some sort. There's also wraparounds and wearables. There's also even a swallowable pill for internal organs and catheters for internal organs. And then there's also panels and mats. So there's literally dozens of ways to deliver the red light. And so it's really condition specific.
I've been a member of gyms or various health and wellness facilities that offer the red light. Is there a difference in quality? Like a gym that offers red light, is that going to be like your top notch, something that you would want to actually invest in, or is this something best purchased individually on your own?
I think that it depends on the spa or gym. If they're using medical grade red light mats and they're using it properly, which means you have to literally be naked on the mat itself. A lot of times you see ads where someone's in a leotard standing 3 feet away. Does no effect at all because it doesn't go through clothing, and once you're about 4 inches or more away, the beam disperses. So you have to have it right up close. But if you have a mat or a panel or even a bed and you're right up against it, you're getting the right amount of dosage, and that's going to help you at the front end condition your body to be more successful in your competitive athletics or your exercises. It's going to help you at the other end recover and bounce back quicker. Every NFL team uses it because you have these, a linebacker who's 30 years old. In the old days, they'd be back on the field on like Tuesday or Wednesday, put on the light, they're back on the field Monday afternoon training. The International Olympic Committee in 2016 declared that red light was a natural process. So every major sports team in the Olympics right now are using red light. Every major country in Paris was using red light as part of conditioning for their athletes.
So the athletes can use it, but us peasants, they don't want using it, right? Well, what is ultimately your hope as far as red light therapy is concerned? What do you wish to see happen in the near future here?
I would hope every hospital has it. I would hope every emergency room has it. I would hope every veterans hospital has it. I hope everybody who can afford it, because most of them are the good medical ones are still under $2,000, that every home has it. I mean, that's really, we want patient access everywhere possible. And again, with red light being delivered mostly by LEDs, and most of these devices have self-timing. You do not need a clinician to help you, but to assess your situation, yes. To monitor your situation, yes. But to actually use it, you can use it yourself.
Very good. Well, thank you so much for all of this incredible information. Where can people go to learn more and find out more about what you're doing?
The one-stop shop is our foundation website, which is pbmfoundation.org.
Awesome. Scot Faulkner, thank you so much.